Today is the part 5 of the live being a homeopathic psoriasis specialist or being a homeopathic specialist. This is my journey and what I did. I'm just going to tell you. Now in this part 5, we'll be discussing when you set up your clinic. Last time we just told you about the types of the patients. Now today we will be talking about very sensitive subject. You see, we are doctors, we are human beings. We also fall sick and we need to go to other doctors, or other doctors come to you, to your clinic for the treatment. And what should be your strategy or what should be your behavior towards other doctors? To be very frank, I started my practice and many a times you also need to go. I also wanted to go, and some doctors came to me for the treatment. And what should and how I behaved with them. Number one, whenever you are a doctor, you are having a little superior hand than anybody, and you should control him. And if you really, suppose some allopathic doctor comes to you, you are a homeopathic doctor. So being a doctor and being a patient, there is no difference as such. So you have to do your duties and you have to be having a little super hand. So when allopathic doctors come to you as a patient, so majority of the doctors have low self-esteem, my friends, and they are very happy. Rather they bow down too much and they welcome them. Okay, you have to welcome them, but you should have an attitude of a doctor and they are a patient. So while fulfilling your duties, you must ask them questions without any fear, and you should be very strict, and they should follow your instructions. Otherwise it will be difficult for them to get the results. So always tell that now I am a doctor, I will be taking a decisions for your medicines and I will be making a diagnosis, and you will be a patient. You will not be asking me many questions. Similarly, when you go as a patient to any doctor, keep your knowledge aside. Be a patient. Follow the instructions and do that. The second important thing is about the fees. Should you charge fees to the doctors? Yes. According to ethics, you should not charge fees to your teachers. While in medical college, there must be your teachers, and if they come to you, it's ethics that they have taught you, and as they are guru, you should not charge them fee. But what about others? You see, in the times 30 years ago when I was practicing, there was a tradition that a doctor should not charge fees to a doctor. And some doctors used to give you concession or they never charge you fees, but it was under consideration of some fear. If I charge him fees, he may not help me in my practice, or what the people will say. But nowadays, recently I find people are charging fees to doctors even, because today is the era of a competition. Definitely we are having too much social pressure, too much financial pressures. You should charge fees to the doctors. Definitely you will give them concession regarding other things, or you can charge them little half of the consultation and give concession in the medicinal charges, but not free. I have my personal experience when I go to the other doctors for consultation. Some of them do not charge me, but some of them just charge me as a normal fees, and I have to wait in the clinic and no special consultation. I don't mind for that. But at the same time, when they come to my clinic, what should be my behavior? Definitely it is not the way they give, but I am following all the rules and regulations that other patients follow. They have to follow. Being a doctor, you can give them concession for the appointment. They can come directly, no need for appointment, but some charges they must give. And that is the only way they will be confident that you are really doing good for them. One of the incidents that I remember of a famous cardiologist from Pune, in a conference he said that whenever a patient comes to me, a doctor patient comes to me, I charge him for two things. Number one, when I take a consultation charges from him, he is free and he is confident that I will be giving him a good treatment because I have taken the money. At the same time, he also is free that if he has given me fees, he is not bound, or there is no compulsion for him or no obligation for him to give me favor or to send me the patients. So you see, both doctor and patients are free when they have given the fee or accepted the fees. And I think this is the best strategy, which is on the both sides. It's good. Whenever you go to other doctors, pay your fees. Whenever they come, do charge them fees. Otherwise, how you will survive? And I think we all doctors should know these things. Another thing, whenever you go to another doctor, please be a patient. And when they comes to you, definitely give them respect, but do that. This is a strategy I have done throughout my life, and it has given me good results. I have earned good friends in them. Later on, they really appreciate my behavior. And another thing, very important, I will say you, when a doctor comes to you, usually there is a medical discussion. They ask you how your homeopathy works, what medicines you have given me, how they will be cured. Literally, I say, I do not discuss these things and I don't want them to discuss. I say, sir, I have given you medicine. Let us see what happens. How does it work? That is not the part of the treatment. That is the part of the training. If you want to be doctor, I can explain you. Or when you get cured, I will definitely disclose you the medicines, because at the time, if I say you according to homeopathy, the medicines, it may hamper, or you may have some misunderstanding about that, what medicines I have given you. Definitely, I will tell you the medicines once you get cured. All these things should be in your mind, and while treating the patients who are the doctors, definitely follow all these things. Thank you.